Sports account for almost 4 million ER visits each year. The range of injuries can be anything from ACL tears for soccer players to concussions for football players, even as young as 12. Dr. Thomas DeBerardino is an orthopedic surgeon at the UConn Health Center and the team physician for the UConn Huskies. Doctor, thanks for joining me.
Thanks for having me, Yvonne.
So let's talk about, there are actually two general types of sports injuries. Let's talk about those.
That's correct. There's the acute sprains, bumps, bruises, lacerations, tears of the ACL, bone break. Then there's the chronic type, the kind that kind of build up over time. Maybe if we aren't careful about cross training, we can get carried away and overuse an injury and get things like stress fractures or tendonitis, things that kind of sneak up on you over time.
There's so many fall sports, and you're saying when they start off just training, it's usually in the hot summer months. So sometimes it's a little bit more dangerous, would you say?
It's definitely true that the fall sports is more numerous, and the risk of a fluid decrement where you're not taking in enough fluid and you have a risk of dehydration is high, because you've got kids with helmets on, kids with uniforms, and maybe going twice a day in the high school level and above, so you really got to worry about rehydration and maintaining your fluid balance.
Now, prevention is the first step when it comes to protecting yourself against these injuries. So let's talk about some of those bullet points, some of the things that we have to just pay attention to.
Definitely you want to stretch and warm up.
Okay.
You want to build up slowly your activity level. You want to take in fluids. And you want to cross-train, too. Cross-training means, don't always do the same thing every day. Try to do things that might stretch things out that got tight one day, and you're stretching out the other day, and do alternate events. That's all cross-training really is.
You also say wear and use proper gear. And I know it sounds obvious, but that's never the case. Sometimes you just kind of get out to the field and not realize, you're not properly, just protected.
Absolutely important, because you can prevent a lot of little subtle injuries, bumps, bruises, and breaks if you're wearing the right padding. Or you got to wear the helmet, and you got to wear it right. You got to have the chin strap in, and the dentist will tell us you got to have the mouth guard in. And
drink plenty of fluids, and that goes with the point that you were saying that you're in, I don't even know, sometimes really high temperatures, sometimes triple-digit temperatures in the summertime. So that's very important for athletic events. You've got to stay hydrated.
Absolutely. If you're on the turf, it can bump up the temperature on the field by 15 degrees.
And then you also say listen to your body, and that's something that I don't think a lot of athletes do from time to time. Maybe they're just kind of in the zone and they're not necessarily paying attention to something that might hurt, perhaps.
That's really true. You don't want to work through pain. You want to respond to it, back off a little bit, take a rest, and do the right things to help get you through it. And that doesn't mean fight through it all the time. You should get seen if it's chronic. If it becomes if present for more than a week, certainly get checked out.
What is the RICE method, and when should you use it?
RICE is rest, ice, compression, and elevation.
Okay. And then you should use it for what type of
You can use it for almost all the acute injuries. When you have a bump, a bruise, a tendonitis, or a sore joint, all those things help work together. They're simple things that kind of self-help to help get you past and get you back on the field.
And if there's one point you get across today, what would you like for it to be?
Absolutely fluid maintenance. You've got to stay hydrated. Kids got to bring water to practice. Parents have to make sure they, pump them full of fluids when they're done, and that can get rid of a lot of, acute injuries right there. When you're dehydrated, you're more at risk for injury because you're running slow and you're not at your best.
Doctor, thank you so much for all these tips. I appreciate it.
My pleasure, Yvonne.